So I was very lucky to meet with Dr. Aaron Katz, who was the head of holistic urology at Columbia University. And when he heard about the Mitterrand story, of course, as a urologist, he was very, very interested and very impressed. And he told me, okay, would love to try to research those products, but you know, dietary supplements, we cannot do a clinical trial. We cannot have a clinical trial on sick people. We can only have a clinical trial on people who are not sick. So that's how we started with the idea of a small clinical trial on precancerous condition, okay, precancerous cells. And we started with a trial escalation dose on men with elevated PSA, but no prostate cancer, a negative biopsy. So the men who enrolled, at all of them elevated PSA, and we had to go through a first biopsy, and they were supposed to have a second biopsy at the end. So we gave the first cohort of 3 men 2 capsules, and then the next one 3 capsules, and then the next one 4 capsules, and so on. The idea for Dr. Katz was to see, how well the product would be tolerated, and also what would be the effect on the PSA. And you see that everybody, whatever the dosage, had some decrease of their PSA. They were followed for 12 months. So the first cohort, nobody turned blue, green, or whatever. So we went to a second cohort of 4 capsules, and then a third cohort of 4 capsules, and so on. Everybody did well. The problem that we had was that the men were doing so well at the end of those 12 months that they did not want to have a second biopsy. So we were not able to have the end point of the study and publish those results. But Dr. Katz was very happy, nevertheless, with the results, and he went on giving interviews saying, we now know that the combination of PAO and Revolfia extracts can significantly lower PSAs in a 12-month period, and we have found a number of patients who have had a dramatic improvement in their urinary symptoms. Men are clearly having less frequency, better streams, and better flow rates. They are not getting up at night as often. We went on to compare what would be the effect of Pao Pereira with traditional drugs to lower the PSA. And here you have VAH, which is a control. We are now looking at animals, at mice. This is prostates of mice. Interesting. I'm sure nobody has seen prostate of mice before. So, something new tonight. So here is a control group. This is a normal size of mice prostate. When they have BPH, they have enlarged prostate. And here, what the enlarged prostate of mice looks like. When you give them the drug finasteride, you see the decrease of the size of those prostate. When you give Pao Pereira extract, here what you get. And Revolfia extract, here what you get. So when you transfer that into statistics, here what it looks like. Normal prostate, BPH, the drug finasteride, and here Pao Pereira extract. And you can see Pao Pereira alone is not as effective as a drug, and same thing, Revolfia is not as effective by the drug, but it is nevertheless doing a very good job at reducing the inflammation compared to the BPH model and shrinking the prostate. The most interesting is that it is doing that without all the side effects associated to the drug. And those side effects, are impotence, loss of interest in sex, trouble having an orgasm, abnormal ejaculation, swelling in your hands or feet, swelling or tenderness in your breast, dizziness, weakness, feeling like you might pass out, headache, runny nose, skin rash. According to internet, there are the side effects of finasteride. We can do better with precancerous cells. Now, can we do better with cancerous cells? Because that's mostly the goal. So we went on to study prostate, ovarian, and pancreatic cancer cells. Dr. Katz was very interested in studying in vitro and in vivo with mice those extracts with prostate cancer, because prostate cancer, is 1 out of 7 men are diagnosed with prostate cancer nowadays in the US. It is one of the most kind of cancer for men, actually. So here you have mice this time, which have received the prostate cancer. And you see the control group here. The size of the tumor they develop is over 200 millimeter cube. And here, when you give them Pao Pereira, you can see that the size of the tumor is much, much smaller than without the Pao Pereira. And when it is dose dependent, so the more you give, and the better you are doing. Revolfia vomitoria is same thing. Here is the control. And as soon as you give a Revolfia extract, the size of the tumor is much, much smaller, without again, side effects. Now, we went on to see if there was a synergy of action with chemotherapy. This is very important. You don't want to interfere with the treatment. You don't want to. The patient is going to have to go to the hospital, is going to have chemotherapy. So is it possible to associate those extracts with chemotherapy? And you see here docetaxel. Now we are looking at the inhibition. So the higher the better, the higher the more inhibition of cancer cells. So here you have a low dosage of docetaxel itself alone. Here, a bigger dosage of docetaxel. Here you have the Revolfia alone, and you see that the best results are with a mix of Revolfia and docetaxel. All those results are published and are available on the table. We proudly get everything published. Here are the 2 publications on prostate with Revolfia vomitoria and with Pao Pereira. So both extracts are able to reduce the growth of prostate cancer cell lines. They are doing that with different mechanisms of action. Pao induces apoptosis, while the other one suppresses the cell division of the tumor cells. And both were very well very efficient without doing any side effects.